Ready? Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan of the Allegheny County Health Department for our weekly update on the COVID-19 pandemic. As we are now fully into the fall schedule at schools, universities, athletics, etc., Dr. Bogan's going to certainly give the report, but I think optimistically, while we've seen the numbers, stabilize and maybe even a little bit up, with all the activities that are occurring, I think we're very pleased at where the numbers are right now for mid-September. And that really is because of the cooperation of so many people that continue to follow the guidance of the health experts about wearing masks, socially distancing. Our universities, in particular our colleges and universities, have really been very proactive. And I want to thank the students, the 80,000 or so students who are back, who are cooperatively working together. And for those of you not, we want you to follow those examples of those that are doing it. Also, the anecdotal reports we're getting around college, high school sports and youth sports, with parents being very cooperative and wearing their masks, keeping distance at the fields and venues in which their kids or students are participating, have been very, very positive. And the school districts themselves also, with the plans that they've put out. So all of these activities, as we see, can be done safely if they're done properly. They're challenging, but if people are cooperative, we know that these things can happen. One of the big things this week, and Dr. Bogan will talk a little more about this when she talks about, is the Mon Valley testing site that opened. We did the walkthrough on Monday and opened up officially yesterday. Really want to thank all the partners to allow this to happen, to allow testing right in Mckeesport at the RIDC site. And that wouldn't happen without our friends at the state. First of all, the Department of Health helping us there, along with PEMA, the PA National Guard, EMS West, Chief Brown and his team, Emergency Services, as well as Mayor Shrepko and all the folks in Mckeesport have been very, very cooperative. And thanks to Senator Brewster, Representative Davis, and Councilman Macy for also being very helpful in doing that. So with that, let me turn it over to Dr. Bogan to give her report. Dr. Bogan.
Thank you, Rich, and thank you for joining us on this lovely late summer day. So as you all know, schools are back in session. Some are in person, some are online, and some are hybrids. And with the return to school, thank goodness we have seen only very modest increases in our case numbers. Today we reported 73 new cases, and our average for this week was in the mid-50s. Our positivity rate has increased somewhat and is now between 7 and 9%. And in the past week, we have been testing on average a little less than 1,000 people a day. Since the beginning of September, about 20% of the new cases reported to the health department were connected to colleges and universities, and about 2% of the cases were among K-12 students attending some form of in-person class. These numbers really reflect the hard work of all of our schools and universities in planning for a safe return to learning. So I'm very pleased with those numbers. We weren't able to provide a daily report on Sunday due to issues with downloading data from the state. Going forward, in alignment with the State Department of Health, we will no longer be issuing a report on Sundays. We will include any new cases we receive over the weekend in our Monday report. I want to switch gears a bit and talk about the 211 Nurse Triage line. I want to remind people about the nurse call program I discussed last week. The Health Department, the United Way of Southwestern Pennsylvania, the Pittsburgh Poison Center, and UPMC Children's Hospital Pittsburgh Nurse Triage line partnered to add on-call nurses to the resources available through 211. I encourage anyone, parents, physicians, teachers, or school administrators with a question specifically about school and COVID-19 to consider calling 211. The nurses answering these calls have up-to-date COVID guidance and have ready access to and support from local pediatric and infectious disease experts from around our county. Just as a reminder, this line is not intended for specific question about a child's health or a case of COVID-19. Those calls should still be directed to a child's healthcare provider, and school administrators should continue to contact the health department directly with questions or information pertaining to a specific case of COVID-19. So remember to access the nurse call line, dial 211. As Rich mentioned, I want to talk to you briefly about the Mckeesport community testing site. I was on site on Monday along with Rich and others to observe a dress rehearsal of testing. It's really an impressive operation, and it really did take an army to put this site together. It wouldn't have been possible without lots of people from the State Department of Health, the Pennsylvania Emergency Management Group, the Pennsylvania National Guard, County Emergency Services, staff from our own health department, from the Mckeesport Police, and others. And the site opened officially to the public yesterday, on Tuesday, and on our first day, we tested 64 people, and I'm glad to report that everything went very smoothly. This site really comes at a very important time. As we've mentioned, schools are opened, colleges are back, cooler weather is going to force more and more people inside, which we know can increase the spread of the virus. So, we've of course been concerned that we'll see increases in our cases, and we know from our experience is that the more we see cases, the more demand there is for testing. So this test site comes at a great time. A few things to remember about the site. We ask people to pre-register online. There's a link to information and registration on our COVID-19 website at AlleghenyCounty.us/coronavirus. If you're not able to schedule online, you may call via phone to 412-209-2262, and the hours are from Monday to Friday from 8:30 a.m. to 4:30 p.m. Both online and phone appointments can be made for the next day only. This is a drive-through site, but if you don't have a vehicle, you can again call 211 and they'll help you find a test location near you. However, no one will be turned away from this site. Finally, I want to just mention that we've received a lot of calls and questions over the last 2 days about the recent court decisions concerning some state COVID safety orders. We are reviewing the decision and our orders do remain in effect. Our experience with COVID-19 in Allegheny County strongly suggests that mitigation efforts and strategies we put in place are effective. We've twice seen these strategies combat surges and keep case numbers at manageable levels. And now we've had about a month of relatively stable case numbers despite students returning to schools, colleges, universities around the county. Our experience here has been quite different than other areas of the country. So, as I say to you each week, I ask each of you to continue to take personal steps to keep yourself safe and those around you safe. Stay home if you're sick, and follow any instructions to isolate or quarantine to help reduce the spread. We should all limit our trips out of the home. The less interaction we have with people outside our households, the less chance there is of spreading and catching the virus. We need to continue to keep physical distancing, and regardless of the size of the gathering, keep at least 6 feet away from others. And it's still important to wash your hands with soap and water or hand sanitizer, cover your coughs and sneezes, and clean frequently touched surfaces. And this is especially important now as we enter flu season, because that is also the same way that coronavirus spreads is how flu spreads. So one final ask of our community is to please schedule your influenza vaccines. So thank you, stay safe, and be kind. I'm happy to answer any questions.
This first question is from Public Source. On Tuesday, the health department reported that an 11-month-old baby since March 14th, how many children younger than 3 have been infected with COVID-19, and if there's anything to indicate how this
We've had a little over 100 cases in children less than 3 in our community since March. The vast majority of children who have acquired infection really have been household contacts. That's how they've acquired it. Let me take an opportunity to also say, child care centers have been open now in our community throughout COVID, and we have seen very little spread of COVID-19 in daycare centers, which I think should be really reassuring to the public. And again, I think Rich said this in his comments, that if we do the right thing and we follow the guidance given out about mask wearing, physical distancing, hand washing, you really can keep this virus at bay. And so our child care centers have done an incredible job taking care of our children while people are at work with very little spread of the virus. It's not that there have been no cases in child care, but there have not been outbreaks and big events. So kudos to all of our child care workers who are doing the hard work of taking care of our children and keeping them safe.
This next question is from WTAE. Announced their plans for trick-or-treating next month. Do you think communities can safely have trick-or-treating with children, and what advice do you have for families?
So trick-or-treating, I think there's some advice that people can follow. So, I was thinking about this. We all are wearing face coverings these days, as we've talked about. So I would encourage parents to make that face covering part of their child's costume, be creative. I know that sometimes crowds are large and people travel in large groups for Halloween trick-or-treating. I'd encourage people to go in smaller groups, again, keeping your pods sort of smaller, less exposure. Keep physically distanced. Have hand sanitizer with you so you can wash your hands between homes if you want. So I think that there are strategies people can use, really sort of common sense strategies and applying what we know about the virus. And the good news is that Halloween and trick-or-treating tend to be outside, which also reduces the spread of the virus.
This next question is from Kitty K. Earlier this week, the health department was reviewing some complaints it had received regarding high school football games. Can you tell us whether anything came out of those discussions?
So we are in the process of reaching out to school districts to really discuss strategies that they can use and to review what they're currently doing and to find ways that if we have any suggestions for improvements. But in general, the schools have been doing a great job at keeping people safe, physically distanced, wearing masks. So again, we'll reach out and reinforce some basic instructions.
This next CDC is telling states to prepare for the distribution of a coronavirus vaccine, something that's projected to be available to all Americans by the middle of next year. Has the county health department begun discussing what sorts of systems, staffing, and resources are needed to prepare the county for a coronavirus vaccine?
Yes, so we are starting those discussions. We've been starting talking about it. I sort of think we've had a number of discussions about influenza, and we're trying some new strategies this year on really getting influenza vaccine out very broadly to our community, working with community partners in that effort. And I hope some of the strategies we're working on now are sort of a test run for strategies we'd like to apply for the distribution of coronavirus vaccine as well. So yes, and today you may know the CDC put out their first version of a playbook for planning purposes, which I printed and will finish reading over the next few days.
This next question is also from WESA. Are you concerned that a vaccine will be rushed and approved before it's determined to be safe?
As most of you probably know, I actually did clinical research before I came to my job at the health department. And I sat on a number of data safety monitoring boards for research trials. And I believe that the system we have set up really around safety for clinical trials is an effective and appropriate one. So data safety monitoring boards are independent boards that review the data about all clinical trials. And I'm sure that the Data Safety Monitoring Board will review all the data that's out there before any vaccine is released to make sure that it's as safe as possible. So I believe in the system that's been set up to do a careful job.
And this final question is from WTAE. The Steelers are playing at home on Sunday, albeit without fans in the stands. Any thoughts on how fans can celebrate the team while also staying safe during the pandemic?
Well, I think I've seen some terrible face masks now, so out in the public. So I encourage you all to keep your face masks on. I think there's lots of ways to celebrate the team and have fun. Again, outdoors, preferably to indoors. You can set up TVs outside, keep physically distanced. When you do have your food, sit separate while you take your masks off, keep physically distanced. And again, shouting, I will remind people, shouting is a very effective way of spreading the virus. So if you're shouting, stand far apart, wear your masks. And again, sort of common sense strategies, small groups.
That was the final question. If there are any closing remarks.
Thank you, Dr. Bogan, and really thanks to the Health Department, not just the work that was done this week to help the folks in the Mon Valley with the Mckeesport setting. I know there was the Mckeesport site. I know there was a lot of work that went into that, but really throughout this very, very challenging month that we've gone through, as we've seen the influx of our students returning, which we're excited about. We want them here. We want them to be safe. They're a big part of the vibrancy of this region. And the fact that these numbers have maintained much lower than other parts of the country that have seen big outbreaks when their collegiate students have returned is really testimony to Dr. Bogan and all of us, the cooperation and the universities and the work they've continued to do. I'd also be remiss without thanking Congressman Doyle, because the CARES money allows us to do some of the things like we did in Mckeesport and the PPEs and some of the things with budget shortfalls that was able to fill the gap in so many ways for Dr. Bogan and her team and some of the health department contact tracers, all the things that we're doing. Also, the first responders, want to continue to thank them and the great work that they do. We want to thank and encourage again our restaurant folks who have had a difficult time. Continue to patronize them, use takeout, be outside, all those kind of good things. And I think what Dr. Bogan talked about, whether it's Halloween, whether it's a Steeler celebration, whether it's all the communal things we'll be doing, use common sense. We know what we need to do as far as wearing our mask, staying distant, keeping separate, watching what you do when you're eating and drinking and shouting and those type of things. So we continue to be safe. We want to keep this community as safe as we can, keep all of our loved ones safe, our community safe. And also I'll give you one other shout out to some folks that have been impacted a little bit. People who ride our public transit systems have been very, very cooperative in wearing their masks, staying distance, and again, we've seen very low case levels in those type of operations. So again, if we cooperate and listen to the advice of the medical experts, we can continue to keep things as open as we can, whether they be our schools, our sports activities, community events, all those type of things we're doing. And then the last one I'll remind people as we're in this season now is voting. Mail-in voting can really, again, keep those lines down long for Election Day on November 3rd. You can vote at home very safely. Your ballot will be mailed to you, all those type of things without having to worry about postage or envelopes or anything else. So we just want to make sure everybody does the things they're doing when they're going to work, recreating with their families, doing it as safely as they can. So let's have a safe week. Everybody continue to stay healthy and